I am Dr. Chintan Desai. I am a shoulder specialist. Let's understand the shoulder. The shoulder is a ball and socket joint. Internally is the labrum, which is the stabilizing structure of the shoulder. Over the top of this attaches the biceps tendon. This is then all covered by the capsule of the shoulder, which is supposed to be normally loose. The capsule is then covered by the rotator cuff. Shoulder dislocation means the ball of the shoulder comes out of the socket. The first time the shoulder dislocates, it causes a tear in the labrum, which is the stabilizing structure of the shoulder. This tear is called as the Bankart tear. The dislocation also causes a defect at the back of the ball, and this defect is called as the Hill-Sachs lesion. These injuries in the shoulder after shoulder dislocation causes it to become loose, and the dislocation keeps happening recurrently. A keyhole surgery is the best way to solve this condition. The procedure is performed under local anesthesia and general anesthesia with small 5 mm cuts on the skin. The surgery is called Bankart repair and remplissage. This means that we repair the labrum tear and also fix the Hill-Sachs defect. I use all suture anchors or soft anchors to do this repair, as this does not cause any irritation in the joint in the future. If this primary surgery is not performed, the shoulder continues to dislocate recurrently. This recurrent dislocation causes the Hill-Sachs defect to deepen, and you can develop a bone loss on the socket side as well. These bigger defects require a different surgery called as a Latarjet surgery, and this involves us putting in a bone graft in the place where you have lost the bone. The recovery process involves using a sling for about 2 weeks to reduce the pain and swelling. Physiotherapy starts after 1 week of surgery, and by about 6 weeks you can expect your arm to move up completely in the front. However, you will still feel stiffness in this movement and this movement, which we start working on between 6 weeks to 3 months. By about 3 months, you should expect to have normal movements, and by about 4 months, normal strength. Most of my patients go back to sport by about 4 months after the surgery. There is an expectation of about 5% tightness in shoulder movements after the surgery, which does not affect your function at all.